and it's no secret that my top priority throughout my time in the legislature has been to protect the most vulnerable among us. As you know, that we fought very hard to make sure that California was protecting kids from human trafficking. We increased penalties to ensure that buying and selling of children was no longer a misdemeanor offense. We made sure that proper penalties were imposed at the most heinous crimes when they were committed, and that's exactly why we're here today. In 2018, AB 1810 was signed into law, creating another collaborative court program as mental health diversion. Now, I believe that this program was created with good intentions to divert those who truly have mental health issues and disorders that have committed low-level crimes and would benefit from mental health treatment programs. However well-intended this program was, and it might have been, in reality, it did not come with enough guardrails and has become a get-out-of-jail-free card for the violent offenders across our state. The lack of safeguards to disqualify violent repeat offenders, combined with limited judicial discretion to determine when the offense poses a risk to public safety, has opened a door for violent offenders to use mental health conditions and mental health diversion as a way to avoid accountability for their crimes. As a result, perpetrators are returning to our communities without sufficient protections in place and are habitually reoffending. All across California, justice has been diverted, and perpetrators have gone free with no accountability for crimes that they've committed. And victims are left alone with no resources, no justice, and no punishment for the perpetrator. This is not about politics. Let me say that again. This is not about politics. This bill is about public safety, and it's about justice. We are diverting justice from victims who deserve it desperately. Victims were physically attacked, assaulted, and some even murdered. Their perpetrators received diversion and took a few classes, maybe some medication, and then within a year or two, everything was wiped from their record as if the crime never existed. But the victims still carry the pain, and the families that lost loved ones still hold on to the hope that someday the individuals who destroyed their lives will face the consequences they so rightly deserve. Across this state, and especially right here in Sacramento County, we have hours of recorded jail time calls where career criminals are talking about using diversion for a get-out-of-jail-free card. There are countless stories of repeat offenders using diversion as a way to circumvent the justice system. Some of those cases include an offender in San Francisco who broke into a home, he took a shower, and wearing only a towel, he climbed in and fell asleep in a child's bed. Thank God the child was with her mother. Following that incident, he was placed on a diversion for subsequent offenses. In August of 2025, that same individual physically assaulted multiple people after they refused to give him money, even punching a 79-year-old man in the face, and took his bicycle, stealing it, and he fled on the individual's bicycle. Despite a negative report from his prior diversion program for non-attendance, the habitual offender was granted mental health diversion yet again. Just 45 days later, after he was granted mental health diversion, again, he allegedly committed a brutal home invasion and murder, breaking into a 38-year-old woman's residence, beating her severely, strangling her, and leaving her dead in a pool of her own blood at the end of her bed. That was a violent repeat offender out on diversion. The Sacramento County Sheriff's Office and Assemblywoman Correll, who are with me here today, have repeatedly brought to light the story out of Sacramento County where a precious little 3-year-old baby was abused and then fed lithium by his parents. They both applied for diversion. There's a sergeant here with us today that's going to tell you more about that specific story shortly. And guess what? The sad reality, it's just not low-level offenders and common individuals or criminal masterminds using diversion as a tool to avoid serious penalties. It's upper middle class, duly elected politicians who are also utilizing mental health diversion as a get-out-of-jail-free card. In my home county, Kern County, Former disgraced Kern County Supervisor Zach Scrivener, who serves as an example of how broken this program really is. After taking a variety of illegal substances, he sexually assaulted his own child, and his own sons had to intervene to confront their father to protect themselves and their siblings. One of his sons is here with us today. He's a brave, amazing, incredible young man. His name's Robert. He's standing right here. He's here today to share his story, including the fact of how he was injured while trying to stop his father from committing this heinous crime. The entire family has faced unimaginable trauma from this incident. Yet, after Zach Scrivener was charged with 3 felony counts of child abuse and 2 felony counts of possession of assault weapons, his attorney asked for mental health diversion, and it was granted. Let me repeat that, because it's really hard to believe. After sexually assaulting his child, taking illegal substances, and felony weapons charges, he never had to enter a plea, he never had to serve a day in jail, and after completing his diversion program, not only will his record be completely wiped clean, but he can also volunteer at a school and around children because nothing, absolutely nothing, will come up on his background check. Imagine the trauma this incident caused these children and their mother, Christina Scrivener, who is with us as well today, amid allegations of abuse and an ongoing investigation. Yet absolutely no one in this case is facing justice, and again, we're left with victims who have no recourse. Unfortunately, there are cases just like this all across the state of California. Mental health diversion has become the perpetrator's get-out-of-jail-free card. Meanwhile, while victims and their victims of these crimes, like Christina and her children, must deal with the aftermath of the trauma. We have to fix this broken mental health diversion program, allowing repeat offenders who have documented history of violence and repeat offenses to qualify for diversion denies a victim real justice. Again, this bill is not about politics. It's about justice for victims, and it's about public safety. It's about justice for sexual assault victims. It's about justice for families that lost a child because of the crimes that were protected under mental health diversion. And it's about justice for domestic violence individuals, and so much more. There's a case in Los Angeles County that's being prosecuted by Nathan Hockman, the district attorney in Los Angeles, where a repeat domestic violence offender has abused his wife, got diversion, abused her again, got diversion, abused her again, and now that woman may not ever survive. I can tell you that justice diversion is justice denied. My bill, SB 1373, will ensure that those that commit violent crimes, such as attempted murder of a child, assault resulting in death, and domestic violence with great bodily injury, are no longer eligible for a mental health diversion program. It will allow judges to have full discretion and grant diversion if, based on past history, they feel the defendant, and not grant diversion, I apologize, that if the judge feels like their prior history or they're a threat to future public safety. It will also ensure that prosecutors have more tools in their toolbox to verify the validity of the mental health diagnosis, which will qualify the defendant for diversion. Diagnosing criminal defendants with mental health conditions has become a niche business. One marriage and family therapist counselor here in Placer County has evaluated 300 criminals and diagnosed 300 with a disorder that makes them eligible for diversion. When a defendant commits a heinous crime and the therapist diagnoses them with a condition of any type on this DSM-5 list, Google it. It's a DSM-5 list. This is probably 6-point font, and it is 9 pages long, where somebody can get diverted for mental health because of one of these conditions. Everything from sleep disorders, eating disorders, depression, anxiety, addiction to marijuana, drug and alcohol, caffeine addicted, even erectile dysfunction is a disorder that can be claimed as a crime and connected to mental health diversion. This bill will allow these prosecutors to question this individual making these connections to mental health diversion. Prosecutors have the ability to properly review and scrutinize that diagnosis under my bill, and we need to make sure that those who truly need diversion have it, This is not a knock on the original bill. It should have been, the well-intended pass of that bill was good, but what's come of it and the consequences is not. I'm honored to have my co-authors here, Senator Nilo, Assemblywoman Maggie Carell, with me here today. I'm also grateful that my co-author, Senator Rubio, who is unfortunately can't be with us today, has been a long advocate for survivors of domestic violence. We also have Sergeant Seidel from the Sacramento County Sheriff's Office, as well as my constituents, Christina and Robert Scrivener, and victims advocate Lauren Skidmore with the Open Door Network. Speaking first will be Senator Nilo.
Thank you, Senator Grove. So Senator Grove laid this out extremely well, and when it comes to public safety issues, both she and Assemblywoman Carell are heroes in this space. She talked about well-intentioned policy, but when that well-intentioned policy takes away essentially judicial discretion and doesn't particularly well define who the mental health expert is that's going to help adjudicate this, what could possibly go wrong? We have a perfect example of unintended consequences. And there are lots of examples of this, one of which actually happened in the community where I live in Fair Oaks. Carlos Romero was stabbed and killed by Jordan Murray in 2024 after Jordan Murray had committed 2 separate thefts with assault involved in each, and he was given mental health diversion, essentially did no jail time, and about a year later committed that murder after an altercation, and there was a space between the stabbing and the altercation, so it wasn't a crime of passion at the time. It was they met up later, and the murder took place at that time. This is a perfect example of the unintended consequence of this bill, and it absolutely has to be reformed, and that's why I'm a proud co-author of it.
Thank you, Senator Nilo, for always standing up for your constituents and Californians. Next, I have Sergeant Seidel, Sacramento County Sheriff's Office, and he is a specialty in child and abuse charges, or claims, I guess. And you will just be shocked at some of the stuff that he says.
Thank you, Senator Grove. Appreciate it. Yes, I'm the supervisor for our Child Abuse Bureau with the Sacramento Sheriff's Department, and as such have witnessed quite a few very difficult, torturous-type cases over the years. What I'll give you is an example of one that not only was this eligible for mental health diversion was granted for both defendants, and at this point, both defendants have completed mental health diversion, and I just confirmed yesterday through my own searching, all records of their arrest have been removed. In other words, if anybody were to run their names through the state criminal justice system or even look in the Sacramento County system to try to find evidence of their prior case, it's all gone. So with that, this case involves 2 mothers, Emily Leonard and Raylissa Rivera. Essentially in March of 2023, Emily took their son, who was 3 years old, to an emergency room here in the Sacramento area because the child was sleepy. When the medical staff finally examined the child and ran tests, they found the child had a toxic level of lithium in their blood. Emily came up with reasons about how the child must have gotten it accidentally, had no idea what was going on. There were also unexplained bruises and scratches on the child's face, and she could not explain that beyond perhaps self-harm as a child with autism spectrum disorder. So as the investigation went on, we found that, and Emily herself later admitted, that she and her girlfriend Raylissa, they had been feeding their child lithium pills sometimes half a pill, sometimes an entire pill a day that were supposed to be going to one of the adults. They were feeding those pills to their child to keep him calm. And when their child would act out, they would put him into a bedroom that had nothing in it, close the door, and push heavy furniture in front of the door. In forensic interviews with the other children in the house, we found that this happened almost daily and had been going on for about 5 months. So the levels of lithium in the child's blood were not from a single occurrence. They had been going on for months in order to keep the child safe. Raylissa did not like the child, and in fact, Emily would cover the child's head with a blanket so that Raylissa wouldn't have to look at the child because the child made Raylissa upset. When we, as the Detective Bureau, went out and investigated this case and searched the house, we found the room that the child had been in. It was overflowing with garbage, and there was cat feces on the floor and smeared onto the walls. This case was pretty horrendous in terms of neglect and abuse on the part of the parents, Raylissa and Emily. So both were arrested, both were charged by the district attorney's office, both applied for mental health diversion, both were opposed by the district attorney here in Sacramento, and both were granted mental health diversion. And after a period of a little less than 2 years, the court was satisfied with their treatment program, declared them completed, and their records are sealed. As it says in the code section, 1001.36, if the court finds the defendants have completed successfully, it is as if the arrest never happened. So yes, if any of these folks, Raylissa or Emily, apply for in-home health care, volunteer at their child's school, any other job that might require a background check, it is also stated in the code that when asked such questions, they are allowed to say, I've never been arrested and I never have completed diversion. It is as if it never happened. So this is one of our more horrendous cases, and I really appreciate Senator Grove, Senator Nilo, Assemblymember Krell, Assemblymember Rivera in particular. Thank you very much for your support in this area. And I can tell you from one of the frontline workers, it really means a lot to us that we can try to correct some of this in the near future. Thanks.
Thank you, Sergeant Seidel. Next, just an incredible individual who works in this space and has worked in this space prior to becoming an assemblywoman. She worked at the DOJ, and she was an extraordinarily effective prosecutor, and I'm glad she's joined us in the state legislature, Assemblywoman Maggie Carell.
Thank you. Good morning, everyone. My name is Maggie Krell. I have the honor of representing Sacramento here in the Assembly. I want to thank Senator Grove for her years of leadership on these issues and for bringing this bill, and also the other co-authors, Senator Rubio and Senator Nilo. I also want to thank you, Robert, for being here, for your courage in being here today. As the past speakers have discussed, there are cases throughout the state that exemplify the way that the mental health diversion system right now is being abused. All of us up here have said, and I will say, that we believe in mental health diversion. We absolutely believe that it can be effective, that some defendants should get a chance to complete mental health diversion, and that it is an effective way to deal with certain crimes. However, the floodgates have been opened, and some of the crimes where people are getting diverted are just simply too serious for that level of criminal justice enforcement. Some of these crimes aren't even eligible for probation. So when you're talking about abuse of a child almost causing death, and abuse of a child causing death, and repeat domestic violence, these are really serious offenses with a high level of public safety impact, obviously for the victims. The impact on the court system as well. The cases are flooding with these motions for diversion. In Sacramento, almost 50% of cases defendants are petitioning for diversion on. And another thing about the law is you're only allowed to get diversion if a suitable placement exists. The problem is we don't have enough money or enough placements for all the cases that could qualify for diversion. So by narrowing the class and by increasing the court's discretion, we're allowing those who would truly benefit from diversion to really have an opportunity to have a slot in those programs. I will leave it to that. Happy to answer questions. Thanks so much for having me here today.
Thank you, Assemblywoman Krell. I have a constituent. I have 3 constituents here today. The first one that's going to speak is a victim's advocate. Her name is Lauren Skidmore from the Open Door Network.
Thank you, Senator Grove, for asking me to be here on behalf of our victims and survivors. Second chances should never come at a victim's expense. I don't think you all understand the gravity and pain we are describing here today. When you have to look at a woman who has been mentally and physically abused to the point of such fatigue that she no longer wants to live, and then you have to tell her that her abuser will see no time behind bars. When you look a mother in her eyes and tell her that her child's abuser will only receive therapy and potentially medication and then walk free in a year or less, this is what we as advocates are faced with. This is the dark reality of mental health diversion. The things that have been discussed here almost feel unimaginable, unreal, and some feel like they're from an alternative universe. Yet, abusers are walking out of diversion programs unchanged, re-victimizing their victims and potentially abusing again. I know mental health diversion was meant to be good. A part of our organization is to support thousands of homeless individuals every year. We see them in survival mode, and we see them make mistakes like breaking minor laws to gain access to basic needs, food, housing, and basic elements. But in these situations that we've described here today, these are not the population that mental health diversion was intended for. We believe in rehabilitation. We believe in mental health support. But we also believe, as victim advocates, we're watching hearts break before our eyes. As we try to continue to provide a speck of hope during these processes, that's our calling, but it's the last piece of hope for survivors. And today, I wish that instead of a slim chance of hope at what should be a just system for survivors and victims, we hope for systemic change and support SB 1373. Thank you to the children and families out there suffering. And don't lose hope, because senators like Senator Grove and the elected standing behind me, we are here with you. Thank you.
So the next constituent that's going to speak is Christina Scrivener, and I think she's going to address it from a mother's perspective about the things that happened to her family and how she was affected by it.
Good morning. My name is Christina Scrivener, and I'd like to start by thanking Senator Shannon Grove for her unwavering support to protect all children in California, including my 4 children. Faced with inexplicable trauma, my courageous children bravely and honorably shared the truth of their abuse with law enforcement and promptly had the events of their most traumatic moments broadcast daily in the media for months and now years. We tell our children to speak up. Speak up for yourselves. Tell the truth. Be honest. And my children were, and they did. Their answer to their plea, their cry for help, was a stark reality of a broken system under mental health diversion. Tragically, shockingly, and unbelievably, my children's cooperation with the system led only to their own personal exposure and vulnerability, with 0 consequences for their violent abuser. As a mother, I want to tell you this diversion meant nothing to me before I experienced what rocked my family. As a mother, I need you to know how important it is that no more innocent survivors of abuse are denied protection and justice. As a mother, Senate Bill 1373 is the hope I look to in this dark reality my family faced from those we trusted.
And last but certainly not least is one of the bravest young men I've ever met, and I would like to ask Robert Scrivener to share.
Good morning. My name is Robert Scrivener, and I'm standing here today in support of Senator Shannon Grove's Senate Bill 1373. My own father, who is an elected official in Kern County, assaulted my siblings and myself and was granted mental health diversion. Our case was a clear example of our flawed system. Because of my own experience, I feel compelled to speak out, not just to address my own hardships, but to protect present and future victims, that without these reforms, will not have any hope of justice.
So with that, we will take questions, if you have any. And who's first? Yes, ma'am.
Assemblymember Stephanie Nguyen has introduced a similar bill. I was just wondering if there was any conversations with her and her bill, and why, there is no, partnership with those two bills.
So I've had conversations with Assemblymember Nguyen, and she was a champion that helped us with SB 1414. We've worked together in the past, and we just texted and talked just yesterday. Sometimes it's beneficial if bills are started in separate houses, because if it makes it out of one house, it maybe not the other. It's a better strategy to make sure that hopefully we get something across the governor's desk.
So clarifying, you do support her bill?
Absolutely. Any other questions?
Senator, a question from John Cox of the Bakersfield, California. How this bill compares with the bill introduced recently by Assemblywoman Dr. Jasmine Bates?
So our bill, our bill is a bill that goes after judicial discretion. We want to make sure that judicial discretion is available, and we want to make sure that repeat offenders are not allowed to have diversion. And we also add in several items on the list of crimes that cannot be committed that get diversion, and I think it's a little more thorough. But I applaud everybody who is trying to go after this particular situation. Maggie, did you want to say something on the Assembly side?
Sure. I'll add the point that, I'll just add the point. I mean, clearly this is a bipartisan issue. I'm very supportive of Senator Grove's efforts. I'm also a co-author on Assemblymember Nguyen's bill. We need all hands on deck when it comes to reforming this system. The judicial discretion part is really important. That's the emphasis of Assemblymember Nguyen's bill. This bill right here also eliminates certain crimes from eligibility, such as repeat domestic violence, attempted murder, abuse of a child causing death, abuse of a child causing injury, felony child neglect. So making sure that those crimes are never eligible is one of the focuses of this bill that doesn't exist in the other bill. But the other bill is an equally important tool that we're going to be pushing forward.
Assemblymember Nguyen, this is something you can touch on as well, but right now, without legislation like this or Assemblymember Nguyen's bill as well, what are some of the counter efforts victims are having to take to somehow try to counter or fight against requested mental health diversion?
Well, there really is none. It puts victims in a really awful position, even though we have a Victims' Bill of Rights that should be guaranteeing victims a voice at every aspect of the proceeding. They're really not getting a voice here, and these diversion grants are happening pretty summarily without adequate input from anyone.
Any other questions? Yes, Jason. So the bill was actually signed in 2018. I was here. I did vote no against it, and we did argue against it. But the intent of that bill was for low-level offenders, people who with, drug crimes, things like that. No way did I ever think that diversion would be what it has become today. And when I recognized that was when we all saw the Zach Scrivener case in the newspaper about diversion.
Not just as a lawmaker, but as a human being, someone who is a resident of California, when you start looking at this and you see how many people arrested are getting mental health diversion, what was your reaction?
It was horrific, and anger. There was those specific responses. But also, if you have time to sit down and talk to Sergeant Seidel, that's just one story. Some of these stories that are happening across this state that are some of the most horrific crimes that you could possibly imagine are being granted mental health diversion, and that was not the original intent of the bill. And so this needs to be fixed, and whether it focuses on judicial discretion like Ms. Wynn's bill, Assemblymember Wynn's bill, or if it focuses on the extended categories that cannot be eligible for diversion under our bill, and also our bill focuses on repeat offenders, like the case that's down in Los Angeles. And I know some of the opposition will say those are outlier cases. They're not. And the reason why they're very hard to find, and Sergeant Seidel can probably testify to this, once it's gone, you have to go back to the original investigating sergeant. There's no record of it anywhere, and get their information and their data. And some of them don't even keep all the records because there's no reason to, because the case absolutely doesn't exist once they complete the mental health diversion. Correct? Yes, sir? Correct?
Oh, yes, correct.
Sorry.
And lastly, I mean, much like 14 and 1414, this seems like a no-brainer, right? I mean, it seems like common sense.
It does, and it does seem like common sense, and it took us 3 years to get those bills through the building, so it is about common sense, and I'm so grateful for the Democrat co-authors that we have on this bill that are strong leaders in this space. Like I said, Assemblywoman Maggie Carell, Senator Susan Rubio is an advocate and has been advocating against domestic violence repeat offenders from her own personal story. And so we have some strong Democrat leaders on this bill, and hopefully we'll be able to get something across the governor's desk this year.
Senator, follow up on that. Thanks for taking the time, and thanks everybody for being here. Obviously, Attorney General Bonzo is very involved with this. I spoke to him directly about it last year about the Scrivener case. What about Governor Newsom? You mentioned the governor's desk just now. Are you hopeful that he'll be understanding of this? And what is your message for him?
So absolutely, I think we're all hopeful that if we are able to get something to the governor's desk that he would sign it. He has taken up a good public safety position when it comes to human trafficking. You all know that he supported SB 14 and 1414. And so we're hopeful that if we get something to the governor's desk that he will sign it. Senator Nilo or Maggie, did you want to say something? I'm sorry.
I would just say one thing with regard to the phrase common sense. That ought to be
Sorry.
Common sense should be the byline of every story that comes out of this press conference.
Common sense and a get-out-of-jail-free card, because that's exactly what this is. None of these people, specifically the Kern County case, never spent a day in jail, never was didn't spend time in jail, didn't have to make a plea, and just walked out. And that's not justice for this family or the children that were affected or the mother who is going through this. And that's just one case. And I'm not minimizing that case, but that's just one case in thousands that we have across the state of California. And this bill, Assemblymember Wynn's bill, and even parts of Dr. Baines's bill will fix mental health diversion programs.